All right, let's take a look at our case study here on diabetes. So up here at the top, you can see we have a case study about diabetes insipidus and diabetes mellitus. One of these types of diabetes you may be familiar with. Some of the others maybe not so much. So let's look at the information we're given. Karen and Jennifer are two young girls, 12 years of age, go everywhere together. They like to movies, music, shopping, all the things as usual. Among these similarities, they have something else in common. Both have diabetes. Each is unaware of her medical conditions, but that's about to change as the symptoms start to appear. Both girls start to notice how they're always thirsty and frequently urinating. The urinating even occurs at night, and each girl has to get up several times each night to go to the bathroom. Each girl almost always has some kind of drink in her hand. Soft drink, soda, water, whatever that may be. The girls' mothers have recognized the frequent nighttime urination and the occasional bedwetting. In addition, Karen is also very fatigued, and even though she's always eating, she's lost weight over the last several months. Karen's mother notices that even though the two girls are the same height, there's a noticeable difference in their weights. Karen weighs about 80 pounds, Jennifer about 105. The mothers notice that these habits are unusual for the girls and decide to take them to the doctor. The two mothers take the girls to the doctor, and when the doctor hears of the frequent urination and constant thirst, suspects diabetes. Now that the doctor suspects diabetes, he must determine if the girls have the disease, and if so, what type. The doctor asks questions of the girls and runs tests and finds the following. So notice in the first column we have several things that we'll take a look at right here. Here's what was found for Karen. Here's what was found for Jennifer. And here's the normal levels out to the far right. So first look at insulin right here. Insulin fasting levels in Karen, look at this, 0. She has absolutely no insulin present in her blood at all. The other girl, Jennifer, she's within the normal range. Another hormone we've talked about previously, ADH, antidiuretic hormone, also called vasopressin. Notice the first girl, Karen, is in the normal range, but Jennifer's missing this hormone. So notice we see two different hormones missing in each one. There's the urine output right here. It's probably at least double what it ought to be, probably triple for somebody as young as them. And notice water consumption matches it. Ketones in the urine. Ketones are acids released by fat cells when they're releasing their stored energy. Well, notice Karen's positive for them. The other girl, Jennifer, is negative. Negative is what you normally see. Look at the blood glucose levels. Now you'll see very different numbers as far as normal levels, 80 to 110, 80 to 120 milligrams per deciliter is what you'll see in most books. So notice right here the girl Jennifer is within that range, but notice Karen is way above it. Glucose in the urine. This is something that should not be seen in the urine, at least not very often and not very long at all. So notice Karen's positive. It is present in her urine. Jennifer, negative. Same girl, Karen, right here at the beginning, is the one that's also fatigued and has weight loss. And notice how her blood pH is too low. It's a very narrow range for blood pH. It's a very, very important part of homeostasis in the body. So one girl over here at the right's normal. Karen right here, number's definitely too low. A sweet smell to the breath. We'll see later, that's these ketones. We'll talk about what that's about and why that's significant too. And then looking at breathing right here. Again, most people are going to breathe about 12 to 15 times a minute, so one girl's normal. Other one's definitely breathing too rapidly. So let's look at some questions on this information. What are the different types of diabetes? Now, one of these, diabetes mellitus, you've probably heard of before. There's another type, diabetes insipidus, that's much rarer. This is where a person has a problem with a hormone, antidiuretic hormone, also called vasopressin. Now again, this is a really rare type right here. You may never see this in your life, but it does exist. There's actually 4 different types of it. We won't get into all that. There are answers after this which are more detailed, which you can take a look over all that if you wish. But diabetes mellitus, that's what you almost always hear about right there. Here's where a person is having trouble with insulin one way or another. Now there's 2 major categories, and you've probably heard of type 1 and type 2. Type 1 is also called juvenile, because this one right here often affects an individual when they're still young. This is pretty rare, accounts for about 3% of the diabetes cases, and it's often caused by an autoimmune disease. Here's where the body has destroyed something in you that you don't want it to. In this case, it's destroyed the cells in the pancreas that produce insulin. Because those cells have been destroyed, there's no longer any insulin in the body. Remember, that's what we saw with one of these two individuals. Then there's the type 2. Now, this is the type of diabetes you almost always hear about right here, also called adult onset, because it usually happens later in life. This accounts for about 97% of all diabetes cases, and this is all about lifestyle right here. This is caused by people consuming way too many calories and not exercising. That is what causes this one here, nothing else. This produces what's called insulin tolerance. Now, someone's always consuming large amount of calories and they're not burning it off. They're going to keep their blood sugar levels high. Well, when blood glucose levels stay high, so do insulin levels. And if you keep putting some chemical out into your body nonstop, the cells are going to become tolerant to it. In other words, they really just stop responding to it. So with type 1, these people don't have any insulin. With type 2, their body's no longer responding to it in the way that it should. So question 2 right here. What type of diabetes do you suspect Karen has and why? Well, look back up here at our information on Karen. Notice how right off you see that her insulin levels are 0, which is something that should not be seen. No insulin in someone definitely points towards type 1 diabetes mellitus, as we mentioned before. No insulin is a big key sign and indicator of this one right here. Glucose in the urine is another. Shouldn't be seeing blood sugar in the urine. You can see it for short amounts of times and low amounts, but on a chronic basis, should never happen. Very high blood glucose levels was something else we saw in her. And the ketones in the urine. The ketones are acids. That's why they're also called keto acids, sometimes called keto bodies. These acids are released when fat cells are releasing their stored energy. So think about this. If she has the type 1 and no insulin, well, if there's no insulin in her body, the chemical's not there to tell cells when to take in glucose. So the cells feel like they're starving. Well, if they feel like they're starving, your fat cells release stored energy, and that's when those ketones get released. So all that goes together. Number 3, what type of diabetes do you think Jennifer might have and why? Well, look back up here on Jennifer. Notice ADH is what she's missing right there, so different hormone than what we saw above. No antidiuretic hormone points towards diabetes insipidus, which we mentioned just above. So the no ADH is a big indicator right there. That goes along with high urine output. Remember, antidiuretic hormone tells the kidneys to hold sodium in water. So if you're not releasing that hormone, kidneys won't be holding water the way they should. High urine output's what you're going to see. You see her with more normal blood glucose levels and none of it in the urine, none of the ketones, or pretty much all the other things you saw with Karen up above. Number 4. Why does Karen have such a high urine output if her ADH levels are normal? So think about this. This girl right up here doesn't have any trouble with antidiuretic hormone, yet we see a high urine output. Well, here's why. Because of Karen's chronically high blood sugar levels, she's saturating the transport mechanisms in the nephrons of the kidneys. Now, you're going to see later when you look at the kidneys and the nephrons, which are the functional units inside, that these nephrons can only reabsorb so much glucose. Well, Karen's blood glucose levels are way too high. So what happens is this. She puts too much glucose in these nephrons. And even though the nephrons are trying to pull all that glucose back into her body, that way none of it's lost in the urine, which is what should happen, they just can't do it. That's what's meant by saturation. There's more glucose there than there are transporters to pull it back in the body. So when that happens, the transport mechanisms get overloaded and glucose is lost. Now, if you remember looking back at osmosis, water follows solutes. So now we've got a solute which is being lost in the urine, which should not happen. Water follows that solute, and that's why so much water is being lost. The urine output is so high. This is what's called osmotic diuresis. Osmosis, water following this solute out, which again, glucose shouldn't be lost, is acting like a diuretic, causing a high urine output. So when you lose solute, you shouldn't. Water's going to follow it. And that's what's happening right here with her losing that glucose. Again, remember, your kidneys are never going to get rid of excess glucose levels. All of that excess glucose should be stored up in your liver and your fat cells. So don't let anybody ever tell you that the kidneys are getting rid of excess sugar on purpose. Never happens right there. Number 5, what treatments might the doctor recommend for each girl? Well, the girl Jennifer up here is going to have to learn how to administer antidiuretic hormone. And again, it's also called vasopressin, another name for it. She's going to really watch her urine output and her water consumption. Dehydration can be a problem for her. Now, the other girl, Karen, she's got a bigger problem, right? She's got the type 1 diabetes mellitus we saw up above. So since she has no insulin in her, she's going to learn how to administer insulin. She's going to monitor her own blood insulin levels and learn how to administer insulin when she needs it. She's going to really watch her blood sugar levels. She needs to educate herself on diabetes. She's going to need exercise to help to keep those blood sugar levels low. She's going to really plan her meals and watch what she eats and be careful of things like the bottom of her feet. Some things you sometimes see with people with diabetes mellitus is over the long term they might start to lose sensation in their feet. They can damage the bottom of their feet and not know it and cause even more and more damage, which would be bad. She'll also need to watch her urine for ketones. She sees those ketones, well, those are keto acids being released from fat cells. That means her energy storage sites are being broken down and released. She might want to watch her blood sugar level at that time. And again, those ketones are acids. She needs to make very sure she keeps her blood pH in that normal range of 7.35 to 7.45. So we come back up here to number 6. What long-term complications might each of the girls face? Well, with Jennifer here, her biggest problem is going to be dehydration. Again, she's got a problem with the antidiuretic hormone. She's got a problem telling the kidneys when to hold enough water. So she's going to need to be very cautious about times when she's losing a lot of water. Maybe it's diarrhea, vomiting, maybe it's large amounts of sweating in the heat of the summer. As long as she monitors her urine output and fluid intake, she'll probably be just fine. Now, if Karen is not able to properly monitor her blood sugar levels, the long-term effects could be very bad. If you look at people that have diabetes mellitus for very long times, usually decades, you'll see that can lead to things like blindness, heart disease, kidney failure, amputation of the limbs, and much more. So she's got a much bigger problem in her case. Number 7, Karen's blood pH is unusually low. What is this condition called? Anytime that blood pH number is excessively low, when it's below that 7.35, that's what's called acidosis. When the number's too low, that means there's too much hydrogen. Well, too much hydrogen is called acidosis. Acids are all about hydrogen ion concentration. So she really needs to get this acidosis under control very quickly. Well, 8 reads, why is her blood pH low? Why does she have this acidosis? So notice the presence of the ketones in the urine. Again, these are called keto acids. Those are the ones we're looking at causing the acidosis. These ketones are called keto acids. Again, they're released from fat reserves, from your adipocytes, your fat cells, when they're breaking down and releasing stored energy. Now again, since Karen doesn't have any insulin in her body, her cells aren't being told to take in glucose. So her cells feel like they're starving. In response to that, her fat cells release stored energy, and it releases those acids at that time. So when she sees those ketones, those keto acids in her urine, that tells her she needs to look at her blood sugar level. She needs to look at her insulin levels because her cells are starving and releasing stored energy at that time there. Number 9, why is Karen breathing so rapidly? So there is a reversible chemical reaction that's looked at quite a bit throughout anatomy and physiology texts. Now if we look at what's in this chemical reaction right here, you can see on one side of the arrows on the left, we got carbon dioxide and water. Well, these two will get together and form H2CO3, which is carbonic acid. That will quickly break down into hydrogen ion and bicarbonate ion. So what has this got to do with her breathing so rapidly? This is a reversible chemical reaction. That means whatever happens to one side is going to happen to the other. Now remember we said when her cells are starving, her fat cells are going to release stored energy and release acids at the same time. Well, there's the hydrogen right there. So as they release all this hydrogen on into her blood, well, as you get more of what you see on this side of the chemical reaction, you get more on the other side. And notice how CO2 is on the other side. So again, what happens to one side happens to the other. When her fat cells release all these acids, well, that raises the hydrogen ion levels, and that's going to raise the CO2 levels. So why is she breathing rapidly? Excess hydrogen will cause an excess buildup of CO2. And we get rid of CO2 by exhaling. So she's going to be hyperventilating. She's going to be breathing rapidly to get rid of the CO2. Because if you get rid of the CO2, well, again, what happens to one side will happen to the other. She breathes rapidly and eliminates more and more of that carbon dioxide. That will help to lower the hydrogen ion levels. You can often tell if someone's got acidosis just by looking at them because you'll see rapid ventilation. So that's an important chemical reaction. We'll see it more. And then number 10 right here, why does Karen's breath smell sweet, maybe even fruity? Well, that's from the keto acids, the keto bodies, whatever you want to call them right there. Again, that's those acids released by fat cells when they're releasing stored energy. Since those are lipid-soluble chemicals, they came from lipids, fats, makes sense they would be, they can pass through the walls of the alveoli, which are air sacs in your lungs. They pass through those walls and come out with the breath. Think about if somebody has a lipid-soluble chemical in their blood, it'll come out with their breathing. Think about when alcohol's in somebody's blood. You can smell it on their breath. Same thing right here. So that's those keto acids coming out when she exhales, causing that sweet smell. So if you look down here after this, you've got all this information in more detail if you want to read over that right there. But what we've went over is a nice short little explanation. So I hope you learned something from this case study on diabetes. It's very widespread, especially with the mellitus right here. You'll definitely see this if you work in healthcare. So we'll take a look at more on hormones soon enough.